So hello everybody. I hope you're all well and staying safe, and thanks very much for attending yet another webinar today. My name is Gordon Rattray. I work for European Disability Forum, EDF, on international cooperation, and I'm moderating this webinar today. It's the fifth webinar in a series that aims to share information on the work of the Innovation to Inclusion, better known as i2i project. I'll tell you a little bit more about that shortly. But first, let me do the usual customary and essential housekeeping information to keep us all right for the next 1 hour or so. So you will have noticed probably that all participants' microphones are muted. So don't worry if you were trying to unmute and could not. Regarding accessibility, you can find a link to real-time captioning in the chat box. And as you may have already seen, the webinar also has interpretation in International Sign. Any technical issues that you might be having, please ask my colleague Raquel, who is reachable through the chat box from now on. And for any questions or comments about the topic that we're discussing, please post these in the question box at any time, and at the end of the speakers' presentations, we'll take some time to address those questions. So the chat box for any technical issues and the question box for any questions or comments about the topic. You should also be able to find the presentation that's going to be used in the handouts section. If you wish to download that, feel free. It'll also be sent after the webinar with the link to the final webinar. And the webinar is being recorded, and as I've just said, we will share that video with transcript with all of you and through our website after the webinar. So as I mentioned, as a very brief introduction to the wider project that this webinar is part of, Innovation to Inclusion, i2i, it's a 3-year consortium-run program that aims to address key challenges that persons with disabilities experience in accessing economic opportunities and waged employment, specifically in low and middle income countries, and the countries that are currently involved are Bangladesh and Kenya. It does this in various ways, including exploring innovative market-based solutions, generating data and evidence, and promoting sustained inclusive economic employment for persons with disabilities, particularly women. And that takes me, I think, quite nicely to the topic of this webinar, which is about women with disabilities and employment, and maybe more specifically the impact of COVID-19 and the restrictions that we're all experiencing around this on women with disabilities and how it impacts their employment situation. As you know, women with disabilities already face many forms of discrimination towards equal participation in the workforce, and COVID is impacting this in other ways. So with that, maybe you've heard enough from me. I'll just introduce the 3 speakers that we have. If my colleague could flip to the next slide. We are going to be hearing from, firstly, Ariana Almedia, who's a gender specialist with Plan International. Ariana is going to basically set the scene for us. And then we're going to hear from Misty Ashrafun Nahar, who's Executive Director of Women with Disabilities Development Foundation, WDDF, in Bangladesh. And Misty will bring the perspective of women with disabilities in Bangladesh. And then we will hear from Farooq Ahmed, who is Secretary General of the Bangladesh Employers Federation. So he will bring the perspective of employers, private sector in Bangladesh to the discussion. We will briefly hear from all 3 speakers, and then we'll have a bit of time at the end to take any questions and comments that you might have put as I said, through the question box. So with that, I will maybe not say much more. I will let Ariana share her screen and take us through her presentation. Ariana, feel free.
Hello, I'm here. I'm sorry, I was just unmuting and putting this in full screen. And I need to share my camera as well so you can see me. Okay, I think we're all set. Can you see me?
I could see you, but you've disappeared again.
Oh, I'm sorry. Now.
I can see you fine now, so I assume everybody can. Thanks, Ariana. The floor is
Wonderful.
yours.
You can see my screen as well, so we should be ready to go.
Don't see your screen yet, Ariana.
I'm sorry. Let me see what the problem is.
I see just a large black space.
Sharing my screen. I'm sorry about that. Let's see what the problem is. We've tried this before and it was working very well. Let me just see.
It's coming now.
It is? Oh, here we go.
It's not yet full screen, but it's there.
Okay, so, and you can see my family in the background, which is not what I had intended. So let me just try to disconnect the camera and see if I can put this first, and then we can try to make this work. Okay, can you see it now in full screen?
Perfectly.
Okay, and can you see me?
Perfectly also.
Okay, so we're set. Apologies to everyone. So thank you. Thank you for being here and tuning in. Good morning and good afternoon, wherever you're joining us from. As Gordon said, I will be starting this discussion, and the idea is to set the scene for the discussion we're having today. And I'll do that by looking at Plan International's past experience in response to humanitarian crisis, and also looking at the reports and the experience that has been shared by a number of development partners over the last months on the gender impacts of COVID-19. I'll share a few resources in the end, and also if anyone has any specific interests on any specific topic, I'm happy to share some more detailed resources separately. So as we jump into this discussion, I wanted to highlight that because COVID-19 is impacting us, people around the world in unprecedented ways, sometimes it's not always clear how this is affecting very differently people with different gender identities, people with disabilities, people with different socioeconomic status in different locations in the world. And if we look at the example just of the advice on how to protect ourselves from COVID-19, we see that, well, first of all, this information is not being made always accessible and available to everyone equally. Many people with disabilities are not being able to access this information appropriately. But also, if you look at the three main advices, which are frequent hand washing, staying at home, and keeping social distancing, we know that, for example, frequent hand washing requires available water, and that's not an option for a lot of communities. We know that staying at home requires you to have a decent home to stay in, where you are safe, where you can work from, and that's also a privilege that many of us do not have. And also, when we look at social distancing, we know that for a lot of people that require assistance to perform daily activities, that's also not an option. And so, while comprehensive data is still, not available, and we're getting reports as we go on this crisis, we know that from past experience, this crisis will deepen existing barriers and existing inequalities. And so we need to understand the gender dynamics of this crisis. It's really important for us to make sure we are not leaving the most vulnerable furthest behind, and that we're taking appropriate measures to mitigate the impact of this pandemic as we go. And before we go into the economic impacts and specifically the impact on employment of women with disability, I wanted to highlight some key gendered impacts on 3 areas that have been registered so far, and that will be relevant as we look at the economic impacts. And these areas are health, unpaid care work, and gender-based violence. With regards to health, we have seen that the evidence is suggesting that more men are dying of COVID-19, but we see that the secondary impacts of this crisis are affecting women disproportionately. And you can see in the presentation that much of this impact is being reflected on access to healthcare and medicine, on maternal and reproductive healthcare, care to survivors of gender-based violence, and also HIV and AIDS treatment. And we know this is especially true for people in communities that are more remote and marginalized, and very, very much to women with disabilities. When we look at unpaid care work, we know that before COVID-19 hit us all, women were already doing 3 times more unpaid care work and domestic work than men, with schools being closed around the world and with increased care needs, brought by this crisis. We see this being exacerbated, and we see it more so also with women with disabilities, where in a lot of cases families are relying even more on them to perform these tasks. And finally, I wanted to highlight the impact on violence against women and girls around the world. We know that globally, 1 in 3 women, before this crisis, 1 in 3 women experiences violence at least once in their lives. And we also know that in many national studies show that about 70% of women in many countries are experiencing intimate partner violence. And we see that these women are now, many of them, trapped home with their abusers. We're seeing that the situation of stress, economic stress, the restrictions are increasing the reports of violence, and we've seen spikes around the world. In some cases where we have evidence already, we see spikes of up to 25%. And we know that this is especially so for women and girls with disability, because they are in more risk. There's reports showing that girls and young women with disabilities have up to 10 times more experience of violence than those without disability. So we know that all these impacts will affect them harder. So as we go into the impacts, the economic impacts of COVID-19, we see, and we've been experiencing, and all seen in the news, that the markets are being disrupted, factories are closing, jobs are being lost. But we also have to remember that COVID-19 does not happen in a void. There are existing barriers that were there before to women's waged employment and their participation in the world of work. And so I just wanted to highlight a few of these barriers before we go into what's happening right now. We know what's being reported and shared so far, because we need to understand that these are the barriers that are being exacerbated by COVID-19. And for women in general, we see that norms around unpaid care work and the gender roles that women have, they keep them at home, and prevent them from entering the workplace. We also see that restricted mobility is restricting women from participating in the workforce. We see that a lot of women have limited access to skills and business development. So they are more restricted into becoming active participants in the workforce. They also have less opportunities to develop their social networks, and in a vicious cycle, they have lower self-esteem and confidence, which is a spiral that goes into these barriers. For women with disability in particular, these barriers are exacerbated also by barriers to transport, lack of accessible transport and lack of accessible infrastructure in the workplace. We see that in many cases, training and opportunities to develop their skills are reduced because there's not enough accessible training materials or trainers that are able to deal with different types of impairments. We also see from the business side, we see that most companies do not have yet the policies and the awareness to create safe and inclusive working environments for women with disabilities. And we see even between colleagues that there's negative attitudes and stigma against women with disability in the workforce. And so when we look at the evidence, we know that women's economic and productive lives will be affected disproportionately from men by this crisis. And why? Well, because the traditional, as we were saying, the traditional gender norms and the value that is given to women's role in society, and especially in the workplace, discourages them from entering the workplace in the workspace in the first place, and definitely discourages them from being entrepreneurial. And so, interestingly, as we look at, for instance, Bangladesh, we saw reports, a study done in Dhaka in around 2008, 2009, that we're looking at men seeing the mobilization of female labor as a necessary evil. And there's a quote there that is significant, saying that it's an unfortunate necessity that dampens household honor and prestige and threatens masculinity. And so it's important to understand that women are having this barrier in the first place. But then when they do enter the workforce, they are disproportionately employed in the informal sector, they have less secure jobs, and they get lower wages. And so with all of this, they earn less and they save less. And they are also less able to respond and absorb economic shocks, such as the one that we are experiencing now. Experience from past crises, such as the Ebola crisis, for example, the Ebola outbreak, shows that quarantine also significantly reduces women's economic and livelihood activities, and importantly, that this has long-lasting impact. So it's not just something that happens throughout the period of the crisis, but it lasts for a long time after the recovery starts. And also, again, and this is something that I'll go to numerous times, is the impact in terms of violence against women and girls will exacerbate the cost of this crisis. Violence against women and girls has huge economic cost in any society, independently of the COVID pandemic. But we know that because this violence is increasing during this crisis, the impact on women's participation or reduced participation in education, in work, in their participation, their active and consistent participation in the workforce will be jeopardized. Women with disability in particular face, as we saw before, specific barriers in the workplace. And it's important to note that before this crisis, again, most people with disabilities were not employed. And when they are employed, they tend to be underemployed or get lower wages. And as we saw before, women with disabilities are more vulnerable to discrimination and face additional barriers because they are women and because they have a disability. And in many cases, there's a third layer because of poverty. And so we know that women with disability already face exclusion from the workplace. They are more likely to lose their jobs and experience greater difficulties in returning to work after recovery. As part of the i2i program, there was a market study conducted that found that amongst companies surveyed, people with disability were, well, primarily they were employed in the garment sector in Bangladesh, but they only represented 6% of the employees. And when we look at women with disability, they only represent 27%. And so the number in the other industries was negligible. So we know that this is a situation that will be further exacerbated, and we know that unequal hiring and promotion standards will also be exacerbated. We can assume that for many women with disabilities, their families will further rely on them for unpaid care and domestic work. And as we saw in the beginning, many women will have harder, it will be harder for them to work remotely due to the lack of access to computers, for example, and internet, lack of accessible assistive devices when they're working from home. All these impacts risk rolling back the fragile gains that we've made over the last decades in female labor force and participation, and they will limit women's ability to support themselves and their families, and this is especially true for women with disabilities. And so I wanted to use these last few minutes of the presentation to just highlight some action points that we've seen that best practice show can contribute to mitigate these impacts of COVID-19 in the employment of women and women with disabilities. One is looking at staffing and considering that we need to have gender balanced teams that are appropriately trained on gender and disability to look at the design and delivery of programs. And we need to have specialists in gender and inclusion to be able to ensure that we are delivering and designing the best possible programs. On this point, it's important to include meaningfully and actively persons with disability and the organizations that represent them so that their voices are heard. Another point that you can see, second point, is the doing gender and inclusion analysis and making sure that we are conducting them, updating them, and also using the data that is coming out of this analysis. We need to understand the specific impacts of this crisis on women and girls, on men and boys, on women with disabilities and men with disabilities. We need to understand the impact in different vulnerable groups and use this to make sure that our plans, our response plans, and our programs are interventions that are sustainable and that are impactful, and also that they are not increasing gender inequality and exclusion. We also need to collect and analyze sex, age, and disability disaggregated data. And we need to make sure that we are collecting this information and we're doing this knowing about the risks also associated with you know, the remote collection of data and the remote collection of information and activities. We have seen in our programs that while we know that it's important to keep activities and keep in contact with participants and keep collecting data, we also need to be aware of many risks that are associated with women being on the phone, for example, to give information if they are safe sharing that information when they're in the household. We don't know who's listening to those conversations. Facilitators need to be prepared to deal with disclosure of sensitive information, which is difficult when you're doing interviews over the phone, understanding that a lot of people will be excluded due to the lack of access to internet or mobile phones. And so we need to be aware of these risks when planning data collection and activities. And finally, we need to make sure that we are investing in bringing community, working with community, to bring positive messaging around unpaid care and household responsibilities sharing, ensuring that we are helping communities to understand that we need to redistribute and support women to be able to respond to this to this crisis and enter the workforce once we are able to go back to work. Identifying and implementing GBV risk mitigation is a really important point, because as we saw before, we know that it's an important takeaway for practitioners in this area to recognize the increase of gender-based violence and understand that if women economic empowerment programs already have a risk of increasing violence, this is more so in this situation of crisis, and we have an obligation to consider these risks as we program and implement programs. We need to also advocate for public policies, including COVID-19 related emergency social protection measures that are addressing the specific situation of women with disabilities and are taking into account how they can access those supports. And finally, we need to support solutions that promote equality. We need to make sure that work from home policies are appropriate for women with disabilities. And we need to have the work together with businesses to promote and create jobs for women with disabilities that are gender responsive and inclusive. As I said before, there's a list of resources that I'm sharing as part of this presentation, but if anyone has any questions or any specific resources, I'm happy to share them separately. Thank you very much.
Thank you very much, Ariana. That was extremely interesting. Just to remind people that the list of resources that Ariana spoke about on her last slide is available on the PowerPoint, and I have seen that the PowerPoint, there are some technical issues in downloading the PowerPoint from the platform here. So if you wish it, send an email to my colleague Raquel from in the chat box, and anyway you will get it after the webinar. So not to lose any more time, let me then say to Misty in Bangladesh. Misty, can you join us, switch on your mic and share the perspective of women with disabilities in Bangladesh? Thank you, Misty.
Thank you so much. This is a great opportunity to talk on the situation of women with disabilities in COVID-19 outbreak. Actually, I want to give thanks to EDF invite me to speak on these issues, and thank you, Ariana. She is highlighting the issues of women with disabilities in different situations, which is existing, the barriers women with disabilities faces in different places when they are involved in job. Basically, I am highlighting on the issues of Bangladesh, where women with disabilities are the neglected part of the society. COVID-19 and the government and healthcare response to this crisis are having a significant impact on the lives of people all over the world. It is vital that governments and health officials ensure that human rights are part of this response. In particular, they must ensure that the rights of people from marginalized communities, those who are most likely to see their livelihoods evaporate, their healthcare and employment needs go to overlook, and their lives unpended during the crisis are the top priority. Bangladesh has been listed as one of the 25 high-risk countries. Hence, restraining the spread of COVID-19, government of Bangladesh has declared the countrywide shutdown from 26 March, and the duration of the shutdown has been extended step by step due to the stemming the spread of COVID-19. Consequently, low-income people with disabilities lost their means of daily income due to ongoing shutdown situation. The present situation, and especially the lockdown, has put a large portion of population, including people with disabilities, in a precarious situation. The pandemic and lockdown situation has an adverse impact on the employment situation of population with disabilities, especially women with disabilities, and they are now leading in humanitarian lives. As you all know that women with disabilities has very low opportunities to involve in different job sector, formal and informal, but now the situation is really worse for them because they do not get any support from the government and non-government stakeholders. According to the long-term working experience of WDDF, most of persons with disabilities are living under poverty line, and they are working in informal sector as garment workers and daily wages earners. And there is also different type of jobs they are involved with, like hawkers, daily laborers, rickshaw pullers, van pullers, transport workers, hotel workers, roadside tea stall owners, and due to shutdown situation, they become workless and they have no income to meet up the daily needs of their families, so they are living in extreme poverty and insecure lives. Especially women with disabilities are living in a very high risk condition in the rural and urban slum, because most of the cases women with disabilities are not well accepted by the neighbor, because now the time is maintain the social distance. So in the rural area, women with disabilities are really deprived from their rights, and they actually work in the neighbor family. They work in closure places, but now all the place is not open for them, and there is much difficulties for people with disabilities, especially women with disabilities, to go around. Government has started to list the poor people who are jobless due to COVID-19 situation, but very unfortunate. Women with disabilities are overlooked from all the supports, such as ration card and 2,400 BDT financial service for poor people is started. Today is the inauguration session. Prime Minister of Bangladesh is inaugurated to open the ration card and 24,000 financial taka for taka service for poor people in the country. But we do not get any information from girls and women with disabilities and their families or people with disabilities to get the ration card or the financial service from government, and they are not listed down because the local government chairman member are not very interested to recognize them as poor. At the present, district authority of relief distribution has also make different type of discrimination among the girls and women with disabilities and also people with disabilities. I am highlighting women with disabilities always because women with disabilities has less opportunities to go around, and they do not have opportunities to take any public transport to go the different government offices. So they are deprived basically. District Authority of Relief Distribution has clearly mentioned that only disability card holder and except disability allowance receiver will get this support from the government, which is less than 1%, even whom are in government survey. You know that Bangladesh government is not succeed to incorporate all the people with disabilities in their survey, which is done by Social Service Department. So there is only 1% of people with disabilities are surveyed, but among them, very few have opportunities to get the disability allowance. Some of them are give the student allowance, which is continuing their education. So more than 14.5% of total population and 99% of people with disabilities of Bangladesh are deprived from the government support at the moment. So the women, the people, their family who are not getting the financial support from government, from non-government actors, so how they survive? They don't have job at time because they are not continuing their job due to shutdown situation. Limited number of people with disabilities are working in government and NGOs, but due to shutdown situation, they are not continuing their job and passing days with uncertainty because they don't know they will have opportunities to continue their job or not, because some are go to village without um, uh, uh, before when the shutdown was noticed. So they are not claim that they are staying home. They are on leave. So how long they will be in leave and how they will continue their work, it is the uncertainty now, because there is no strong policy to continue the job opportunities in different sector for people with disabilities. Policy gap is huge. The situation is extremely adverse for women with disabilities, as very recently some women with disabilities had opportunity to start a job in different garments factory. They could not continue their job, and in some cases they are going to lose their job, because when government declared the shutdown, the public transport was continuing. So all the government's worker were go to their village, and they are stay in their place before 4th April of this of 4th April. So they staying their village, and they do not come to Dhaka due to
Misty,
the transport is
Misty, if you
not.
can hear me, this is Gordon. Can you hear me, Misty? It was just to say if you could speak a little bit slower, because I believe the interpreters were struggling to follow you. If that's okay. Thank you. And maybe just another 5 minutes or so, Misty, maximum. Thank you.
Yeah, I will complete. Okay. Thank you so much. Thank you. Make me clear. I'm sorry for the sign language interpreter that I could not maintain. I should talk slowly. Okay. They could not continue their job because in some cases they are going to lose their job, as they are not able to come Dhaka city or their garment factory where is located. Almost 1,000 garment factories have been opened within the shutdown situation, and garments workers without disabilities are going to be joined in their work through enormous struggle. But this is impossible for people with disabilities, including women with disabilities workers, to come their factories without the local transport. So it seems that they are going to lose their job. Women with disabilities are also luckily disproportionately affected by jobless, including in the informal sector, meaning that any sources of income they had to meet their basic needs may have evaporated, while they also are luckily to have fewer savings due to historically lower pay and higher cost of living. Furthermore, in order to bridge the economic losses during the lockdown situation, a large number of companies or factories will terminate staffs in most cases. We are scaring that people, especially women workers with disabilities, will become victim of this termination. A number of unemployed persons with disabilities are trying to their level best and expecting to get job in private sector, but in this unpredicted economic crisis due to the global pandemic, there is no possibility to employ new staff by the companies or factories which is expected. So it is very alarming for people with disabilities, especially women with disabilities, who are waiting for a job from different companies and factories. It would also be noted that all types of government employment procedures, including job circulars of Department of Social Service, for persons with and without disabilities, where priority has been given for persons with disabilities, are going to be postponed as government officials are busy to manage existing situation due to outbreak of COVID-19. So number of people with disabilities, especially visual impaired persons with disabilities, are waiting to get jobs in the resource center, resource school for the visual impaired person in Bangladesh. So women and girls, women with disabilities also are very much feel threatening that in their family, as they don't have job, they are not earning money, so they are facing different type of violence, domestic violence, and they are really thinking how they can go back to their work because everything is uncertain now. So, considering existing situation, it is realized that employment situation of persons with disabilities has massively been affected due to outbreak of COVID-19. So, from the DPOs, we are thinking that how we can make new opportunities for women with disabilities, how they can involve in new employment opportunities. But we also don't know how to do that. When we are going to provide the support to people with disabilities, especially women with disabilities, where see they are crying for from hunger, they are crying from the uncertainty for employment opportunities, and so on. So it is very much painful for us that people with disabilities, especially women with disabilities, are really suffering a lot in the unemployment situation. They are very much eager to go back their job list. So it is my thinking that we need to make new opportunities. We need to make concern about women with disabilities, how they can get good opportunities in future. Thank you so much.
Thank you very much, Misty. It was very good to hear from you and putting some very relevant local context to the general points that Ariana made in the beginning. So, not to lose any more time, let me say, Farouk, could you join us and bring the perspective of Bangladesh Employers Federation? Thank you, Farouk.
Okay. Thank you so much. At the outset, good morning, good afternoon, good evening to everyone.
Farouk, this is Gordon. Can I just interrupt very briefly to say to everybody,
Yeah.
I know we're running a little bit late, and I have been told we can go 5 or maximum maybe 10 minutes over our time. So maybe Farouk, if you can stick to your 10 minutes or so, and then we will have a little bit of time extra for the questions. Thanks very much, everyone.
Oh, sure. The advantage of being the last speaker is that previous speakers have covered almost all the points, so I don't really have much to say. The disadvantage is that I have really don't have any new issues. However, I will try to focus a little bit on the role and the responsibility of the business organizations, Chamber of Commerce, and DPOs, NGOs, etc. However, at the outset, let me express my most sincere thanks to the organizer for inviting me as one of the panelists. I believe I don't need to really elaborate on the difficulties faced by almost all the countries across the world due to this pandemic impact. I would like to cover my deliberation on 5 topics. Number 1, a little bit of introduction about my organization, some basic information about the Bangladesh labor market, and then some impact due to the COVID-19 situation and bailout packages. And finally, I will cover the role of the business organizations, NGOs, CSOs, DPOs, and what are the future steps that can be taken. Well, I represent Bangladesh Employers Federation. It is the national level federation of employers, like any other national employers federation. Our primary issues are to deal with the industrial relations and other associated regulatory issues. Our main areas of interest are skills development, labor laws, social dialogue, employment, wages, negotiations, migration, advocacy, lobbying, representation, and so on and so forth. We also very closely work with the ILO and also IOE, International Organization of Employers, and some other international organization. And the Bangladesh Business and Disability Network, BBDN, is our brainchild. We have a separate platform to deal with the disability issues and to bring the persons with disability in the mainstream of the workforce. So that is another important platform that we have. We are very closely connected. Now about the labor market situation in Bangladesh, we have roughly about 65 million workforce, of which 11 million are in the formal sector, and rest 56 million are in the 54 million are in the informal sector. So you can imagine the huge informal economy where most of our PWDs, persons with disabilities, operate in the informal sector, and roughly about 10% of the total population fall under the PWDs. And Bangladesh is one of the most densely populated country in the world, and therefore it's extremely disadvantageous for the pandemic like COVID-19. Some aspects on the economic impact, it has impacted in every aspects, in trade, in domestic demand, consumption, foreign remittance. The export has been declined by about 60%. Import has been declined by about 40%. The remittance, foreign remittance, has been declined by about another 50%. And in the month of April, our export was only about $500 million US, as against 3.5 million in other usual months prior to corona impact. So you can well imagine about 30 million people are displaced from their jobs and from their earning sources. So it's extremely difficult situation, and I'm sure you all realize, I don't need to further elaborate. Only some business enterprises involved in e-commerce have enhanced their activities because of this pandemic situation. In terms of the bailout package, government has declared almost nearly $10 billion bailout package, starting from paying salaries to working capital and other expenses needed. But you know, these are also quite difficult to get. Basically, these are not grants, these are loans, and it requires quite a bit of regulatory efforts to get these loans. Now, coming down to main important issues, roles of business organizations, Chamber of Commerce, NGOs, DPOs, COSOs, and other voluntary organizations. I personally feel that all the organizations must take a comprehensive approach, and there should be a teamwork in addressing the challenges. One particular individual organization, be it employers organization or a Chamber of Commerce, cannot handle these issues. So all the organizations in respective countries in their field should join hand together and should address the COVID challenges in terms of rendering advisory support, in terms of proper and effective representation, being the voice of business to the policymakers, because in such situation, getting reach to the policymakers is also extremely difficult, what we are experiencing now. So it is very important so that we reach to the policymakers in a coordinated and comprehensive manner. Then business facilitation. As you understand, all the enterprises are facing quite a bit of difficulties in terms of business continuation. So role of these organizations, Employers Federation, Chamber of Commerce, DPO, CSOs, NGOs, to facilitate so that business continuity can maintain, so that demands can be created, so that it facilitates the business to go on. You understand, enterprise sustainability is very important. If the enterprise does not sustain, the jobs don't remain. So we have to consider from that aspect. Next is an important issue of encouragement. We need to encourage, because every time we hear the number of death or number of other infected cases, we get demoralized. Keeping all those aside, we have to fight these challenges because this is the ground reality. Since the vaccine has not been invented yet, and no other prescribed dependable drugs has been invented. So encouragement is a big issue. We need guidance. We need prior planning to do certain things to move forward. And of course, we need to invest a little bit in terms of research and analysis to see the trend and to look for the future journey. Now, what are the future steps that we can take in a comprehensive manner? As I've already mentioned, inclusive planning. Then we have to assess the trends of the future skills. I am very sure this pandemic is going to change the total landscape of the global job market. There will be more opportunities, new opportunities, which should be tapped, and persons with disabilities are no exception in tapping those opportunities. So the DPOs, CSOs, NGOs must consider what are the new opportunities and how to tap those opportunities. And other business organizations like Employers Federation, Chamber of Commerce will have to extend cooperation. That from BF side, I can assure for Bangladesh. Then a greater dependence of technology will increase. So we have to resort to technology. We must also consider contingency planning in every aspect so that it increases business resilience, business sustainability. So contingency is a good aspect or a better aspect of planning. Of course, more emphasis on occupational health and safety related issues. There are certain practices which COVID situation has taught us need to be practiced for next couple of years, I believe, and then those should be well continued. And then definitely we have to have a collaborative approach with shared responsibilities, which is extremely important. And finally, I would say we must learn to set the limit of our self-actualization, self-aspiration. As of now, the business organizations, most of the cases has been very crazy in making profit, in expanding businesses. We need to learn where to put self-limit and where to contribute for the society. I believe my time is over. Thank you so much. I would be ready to face any questions that you feel appropriate. Thank you very much.
Farooq, thank you very much indeed to you. You said at the beginning that everybody had already said all the points, but you somehow managed to find some very relevant and interesting things to say. So with that, let me remind us that we do have an extra 5 or so minutes at the end. So we probably have a little bit more than 10 minutes here. I have received some very interesting questions and comments. I will first of all just state one comment that has come, which I think is important for all of us to remember. The need for policy formulation that supports persons with psychosocial disabilities who face sexual violation in our countries. And I think this speaks very well to the fact that within every so-called marginalized group, there are also always more forgotten and more marginalized groups. So I think this is just good for us all to keep in mind. Then I would say maybe the questions that I have, possibly the first questions would be for Ariana. Ariana, could I ask you to speak for 2 minutes or so, if you wish, to these couple of questions? So what strategies have you put in place or have been put in place in regards to the lockdown, in regards to women with disabilities? Are there any issues of discrimination? So do you have any thoughts, Ariana, on discrimination on women with disabilities regarding the lockdown? And the second question, I know you may already have touched on this, but maybe if you could just repeat it. And the second question is, how reliable do you think data collection through the phone or other medium is, where perhaps women with disabilities or other persons with disabilities might not have access to the technology? So Ariana, maybe feel free to speak to those points or not if you wish, and we have more questions that we can move on with.
Sure, no, I'm happy to. Let me just connect my camera again. So with the first point, I'd say that there's numerous strategies, and Misty will probably also be able to add more to these points. But there's a few options in terms of remote connecting with people remotely. And again, that links to the second point. There's a number of risks with that option, but keeping in touch with your participants, with people that you want to keep involved, is something that we are trying to do remotely through phone calls, messaging, Skype when that's available. Obviously, this has limitations, especially because, as I said before, not everyone has the same access to mobile phones and to internet, and also there are a number of risks that go into that. Another thing is to make sure that we are training facilitators in different ways. We can't just keep business as usual. So when we're collecting data and when we're doing activities with women with disability, with people with disability in lockdown, we need to be able to make sure that we are training the facilitators to cater for those different types of impairments, to have people on board that are able to reach out to people with different types of impairments. And that's not always easy because not all organizations are equipped to do that. And so what I would stress in this 2 minutes would be to do effective partnerships. So we can't keep working in silos. We need to partner with organizations that can bring that expertise. And as I said, invest in the teams being not only gender balanced and adequately trained, but also having people with disability knowledge on board in our partnerships. I'd say just in terms of the data collection, this is a truly, truly difficult process, because on the one hand, we know that we need to do this and we need to be able to collect data from the widest and most varied number of people possible. But we do know that we have limitations in terms of who can reach, and also there are numerous risks in terms of exposing women, for example, to violence or tension for using their phones or for being on the phone or for sharing information in a house full of people. And so these are very, very tricky balances that we need to manage.
Thank you, Ariana. Misty, you will still be hearing us, I hope. You could also feel free to speak to that question that was for Ariana, but I also have a couple of specific questions that came for you, Misty. The first one is there any current plan of WWDF to engage women in household agricultural activities to ensure food security? And the second question, is there any strategy to engage with community leaders, religious council members, other leaders, to ensure appropriate community support for women with disabilities? Do you want to take a couple of minutes to speak on them, Misty?
Yeah, thank you very much. Thank you for asking this question. It is very important question for us, and actually, Ariana already highlight on the issues, but I just add two issues in Bangladesh what we are doing for the sexual violence against women, and especially women with disabilities. That we are in the process of formulating rape law. So we are working on these issues, and in this COVID situation, there is 4 women and girls with disabilities are raped in different areas. So we are taking it in our action, and we talk with the police station, government, and the local leaders, and take initiative. Some accuser is arrested already, some are not. About the sexual violence against women, we have a long platform in Bangladesh. It is a CIDV platform. We say that so we are trying to collect data, and there is some NGOs, INGOs who are also working with us together, and we are collecting data through different formats. Of course, we are now dependent on the social media and the mobile communication. That is the only way to collect data. About the COVID situation, WWDF is planning to provide some seats to rural women with disabilities who have opportunities to grow plant in their places. So we are trying to distribute some seeds. We are also asking some donor to provide food support, including the seeds and other goods, which is encourage women with disabilities to cultivate some plants in their small area. This is one thing. And another is, yes, we from the beginning we are trying to communicate with our local leader who are under the local government, also some local initiatives which is initiated by youth people with disabilities, including people with disabilities. There is some initiatives organized by some other organization and social groups. So we are trying to motivate them to provide support to girls and women with disabilities in different areas. And not only the local leaders or local groups, but also we are trying to collect money from the capital, and we disburse it to the rural areas, people with disabilities, because we need to cash transfer now, or rather than provide food support directly. So this is the way we are trying to different way to how we can provide support to people with disabilities, including women with disabilities. WDDF always focusing to girls and women with disabilities, how they can make comfort in their life at least some way. Thank you so much.
Thank you, Misty. Very good. Farouk, I have a couple of questions for you as well here lined up. One of these is a very general question and one is quite specific. The general question is, Farouk, from the perspective of employers in Bangladesh, do you see anything, have you learned anything from your experience or your colleagues' experience that you could say would be, you could give tips to disabled persons organizations in Bangladesh on how to become involved? What is it that DPOs, can you give us a secret tip that DPOs would like to know, that would be useful for DPOs to know, to increase their participation and involvement in decision-making processes in Bangladesh regarding employment? I hope that question makes sense. And the second question is very specific, which was, what measures has the BEF put in place as recovery measures to fast-track support for women with disabilities after the pandemic? Can you speak to those 2 points, Farouk?
Okay, thank you. First of all, tips for the DPOs, as I have already mentioned in my briefing. Now I will elaborate a little bit. The DPOs has to really tag in with the various organizations, particularly with the Chamber of Commerce and with other business organizations, line associations, like we have Garment Sector Association, Leather Sector Association, Footwear Sector Association, all sectoral associations. So DPOs need to really take a proactive step in communicating and contacting with the business organizations, so that their voice are heard and also seen. So visibility has to be made by proactive engagement of the DPOs. So this is my humble suggestion or advice. In terms of steps taken by BEF, actually BEF has been involved right from the beginning on the policy issues. BEF has given and pursued to the government, to the policymakers, particularly to the Ministry of Finance, to the Ministry of Commerce, to the Ministry of Labor, and for which the bailout packages have been declared by the government in line of the suggestions made by BEF and other business organizations. For example, firstly, about $500 million as a salary for 3 months for the export-oriented industries. Then comes another $3.5 billion as working capital and other expenses for large enterprises. Then comes another $2.25 billion bailout package for the small and micro enterprises for their working capital and running capital. And then comes another 500 billion for the agricultural workers. So BF has pursued the government in terms of policy formulation, in terms of declaring those bailout packages. And in addition, there has been further support from the government, as already Ms. Misty mentioned, in terms of ration card. It means under this card, on weekly basis or fortnightly basis, a destitute family will receive some amount of food grains, and then also direct cash incentives to nearly over 100,000 families. So BF has been involved in all those policy formulation in pursuing the government. BF does not have the resources to have its own financial arrangement, as you understand. But then definitely we are trying our best so that the government is always in picture, and so that people in general, those who are needy, they are supported, and certainly with some special emphasis for the people with disability. And our attempts is not yet over. We are continuously remaining engaged with the government, and certainly through this forum, now it's registered in my mind as a Secretary General, as a key role player in my organization. I will have now more of engaged discussion with the government and the policymakers to have special allocation for the persons with disabilities. Thank you.
Farooq, thank you very much. That was clear and concise. Okay, we have run out of time, folks. I wish we didn't, because I can see many more questions, and I think it's a great topic, clearly, that we need to talk about more. So don't worry, there will be more opportunities. There will be another webinar focusing on gender and employment at some point in the near future. So keep an eye out for the next i2i Innovation to Inclusion webinar. For this one, we will disseminate the video and transcript. Once the transcript is finalized, it will be uploaded onto YouTube and sent to all participants. The PowerPoint will also be available, and it should be fully accessible with alternative texts, etc. Please let me say a huge thank you to the three speakers, Ariana, Misty, and Farooq, and also, of course, or maybe even especially to the two sign interpreters, Gordon and Lisa, and to Kimberly, who has been frantically typing all the way through. So thank you to the support people that have helped with the inclusion and accessibility of this webinar. You will, as we close the webinar, I think, receive an automatic survey opportunity. It's only 5 questions. I think it'll take you half a minute if you wish to let us know what we can do to improve in the future. That would be great. So with that, I will close. I will say thanks again to everyone, and thank you to all for attending. Look forward to seeing you next time.
Thank you, everyone. Thank you very much. Thank you to the interpreters. Thank you to all participants for their patience hearing.